No, I'm holding the mic.
Well, I had prepared some things that I wanted to say, and after hearing these wonderful speeches, I was really inspired by the gal in the corner who was talking about the fact that healthcare, or health and wellness is a right. And it's true, we aren't all created equal. We do have individual rights. We do have a right to wellness. And with rights come responsibilities for you to take care of your own wellness. The problem here is when you expect the government to give you insurance or keep you well and tell you what you can and cannot eat, tell you when and when you have to exercise, you've given away your personal rights. You've given away your personal responsibility to wellness. Wellness is an individual right, and you must take responsibility for it. The government does not grant you rights to life, liberty, or wellness. These are God-given rights, and to keep them, you've got to take them to yourself.
Yeah!
I don't want anybody to not feel good about what they heard, but we gotta try to bridle some of your enthusiasm so we can go quick. All right?
Representative Ellison, are you willing to put your family on this government system, which is different from the one you currently use? If you are not willing to put your family on the system, why should the rest of us?
All right, next point.
Well, answer the question.
Healthcare is a right. It's a right that's been granted by the it's a right that's been recognized by the United Nations. It is very much a right, and I believe as U.S. citizens we have the responsibility, yes, to respect that right. But it is a right, and there are health disparities that are not caused by people who don't exercise, don't do the things that they're supposed to do. There are health disparities that are caused by the system, and we need to change the system so that all people can have and exercise their rights. Thank you.
All right.
Thank you, Keith. Congressman Ellison. I just want to say there's not one program that the government has stuck its fingers in, its hands in, including welfare, including Medicare, including Medicaid, that has worked. Our disproportions are because we are being pimped and we are being used, and they are not going to get it any better taking care of your life.
Yeah.
I have family living in Canada under the universal health care system there, and what they're missing is health care. They have to wait for months or even years to get simple operations and diagnostics, so they suffer there under the health care system there. Also, Canada is looking...
One quick second, sir. All right, just try to keep it down. Just respect the gentleman. I'm going to hang up this mic, sir.
Okay. They also, because they don't get that health care, they're also losing doctors in Canada because of the universal health care system. You don't hear that here, but that is what is happening. The doctors are all imported.
Okay. Thank you very much. Thank you.
Just like
All right,
England.
this lady right here.
I appreciate you having this forum because some Congresspeople won't. My dad has been diagnosed with an acute leukemia. He's got a 15% chance of survival. He spent a month and a half inpatient at Mayo, and we might lose the family farm. But I'm here to tell you that the chemo drug that he is on now that may save his life is illegal in Norway. It is not available in Great Britain because it is expensive. And you know what? The worst thing that can happen to you when you have a health crisis is not bankruptcy, it's death. And I would rather that we lose the family farm and keep my dad alive.
Yeah.
No. Miss Dorothy Robinson, everybody. Everybody knows Sister Dorothy, right?
No.
Yes, they do. I just